Welcome back to The Exchange. A bipartisan group of senators introducing a bill to break up pharmacy benefit managers. Bertha Coombs is here with the details. Bertha, this has been simmering for a very, very long time.
For the last couple of years, there have been a number of bills introduced. Today, this is not just bipartisan, but bicameral. It also has members of the House who are on this. And the nuts and bolts of this are to break up the big PBMs and insurers, although this specifically looks at the issue of them owning pharmacies. Under the bill, which is the Patients Before Monopolies PBM Act, it would basically prohibit a PBM or an insurer from owning a pharmacy. The big PBMs all do right now. They have mail order pharmacies that they have. And of course, CVS, which has CVS Caremark, and Aetna also has brick and mortar pharmacies as well as the mail order. It would require those firms to divest those pharmacy businesses over 3 years, and it would direct the FTC to distribute or disgorge revenue to what they called harmed communities. Now, analysts are saying this is not likely to pass and make it to the floor during the lame duck session here ahead of the new administration coming in. But certainly there is more momentum over this, and this could be something that could be renewed in the new year, given the fact that we do have this bipartisan and bicameral agreement on it.
Thanks for listening to the Pharmacy Podcast Network.
Welcome to the PBM Reform Podcast, where we dive deep into the world of pharmaceutical benefit management, cutting through the noise to uncover the truth. Since 2019, we've been your go-to source for the latest on how PBMs impact patient care, drug pricing, and the very future of pharmacy. Here, we champion the role of pharmacists, the most knowledgeable advocates for medication safety and expertise. Join us as we expose and generate discussions that are reshaping healthcare and explore how we build a better payment system which focuses on advancing pharmacy care.
Today is a really special episode of the PBM Reform Podcast. We have two people who are passionate about reforming our pharmacy benefit managers. We have Greg Reybold, who is the Vice President of Healthcare Policy and General Counsel for the American Pharmacy Cooperative. And we have Congressman from Massachusetts of the 4th District, Jake Auchincloss. It's great to have you here with all of your experience in understanding PBM reform, working with wholesalers, working with pharmacy owners, working with different sectors of pharmacy. This is the most important factor of our pharmacy profession, Greg. I want you to share with our listeners what you've been working on and how things have been going.
Oh, that's right. And, this healthcare policy and PBM practices in particular are ever evolving, right? And we work hard to try to get the policy right on behalf of our members, on behalf of, really all community pharmacists, and, the system as a whole, and most importantly, our members' patients.
Without further delay, we have a very special guest with us today. Very proud to have this hardworking politician working for the American people, someone who really understands PBM reform. Welcome to the PBM Reform Podcast, Congressman Jake Auchincloss from the great state of Massachusetts.
Thank you for having me on.
Representative Auchincloss, it is wonderful to have you here. We know that you have worked with Greg Reybold before, so this is really nice to have the both of you here at the same time. Just right out of the gate, Jake, we want you to give the listeners just an update, a little bit of information on yourself, how hard you've been working on the PBM reform, Pharmacists Fight Back bill. Take it away, Jake.
I am finishing my second term representing the Massachusetts 4th, which is 35 cities and towns in eastern Massachusetts, some of the inner suburbs of Boston, all the way through the border of Rhode Island. And I came into PBM reform really starting with my first term in Congress around 2021, because I represent a big healthcare district, a lot of biotech entrepreneurs, a lot of public health professionals, physicians and nurses and medical device companies. And we were doing a significant amount of healthcare work and a significant amount of drug pricing work in particular, which I had a special interest in. I grew up in a family of medical scientists, and both on behalf of my constituents who pay for prescription drugs and on behalf of my constituents who are researching and manufacturing new prescription drugs. This is an issue that matters to Massachusetts. And as I was exploring drug pricing policy, it's kind of like when astronomers are looking through the telescope and they see planets moving around, but they're wobbling and they're not moving in the way that they should be. And they go back to the data and they what's going on here? It's not lining up. And they always say it's dark energy. It's like 80% of the universe is dark energy, and it's causing these perturbations in the planets, and light is moving around it and it's getting bent, et cetera. And as I was exploring drug pricing policy, it was like there was this dark energy inside of the pharmacoeconomics of how prescriptions are being prescribed and dispensed and reimbursed. And I was like, what's going on here? There's this like irrational black hole at the center of this system. And of course, that led me to pharmacy benefit managers. And the thing about PBMs is 80% of our work with PBMs is just introducing the concept to policymakers and to Americans. Because once people understand what they are, they're the middlemen of drug pricing, so much of what follows actually becomes intuitive. You don't have to become an expert on spread pricing or DIR fees or steering policy, because so much of it is actually just intuitive about the rent-seeking and monopolistic behavior that will always follow from their privileged middleman position in a very concentrated market. And so once I started to unpick that, I met people like Greg. We dug in and we realized that if we're really going to get drug pricing right for Americans, right in a way that leads to more cures faster, right in a way that leads to lower out-of-pocket costs, right in a way that lowers premiums and stops the price gouging, right in a way that empowers community pharmacists to be small business owners and medical providers, if we're going to get all that right, we need to start by reining in the malfeasance, the greed, the abuse of these big three pharmacy benefit managers. And that's what we're doing.
Thank you for that, Jake. Greg, I want to turn back to you. I want to understand what is happening right now that's making the difference. Why do we see both sides of the aisle jumping on the Pharmacists Fight Back Act and pushing for this? We have unity. We have 53 signed sponsors. What is it about this? Is it the timing? Is it the bill? Is it the language? Why are we having what seems like the success that we've been waiting for?
Listen, I think there's a lot of reasons, right? And obviously PBM reform has evolved in a number of ways, but Pharmacists Fight Back Act, HR 9096 at the federal level, from my perspective, really represents a quantum leap. And I think it's resonated, right? We were at a time where in the last 2 years, there are so many drug pricing bills, so many PBM bills that have been introduced, and several of them really, really good. No question about that. But yet, I feel like as big as the problem is, and you can't talk about drug pricing with walking right smack into PBM practices, as big as PBMs are and as large as the problem is, there was sort of, I would say, almost an appetite to nibble around the edges of these practices, right? Light transparency reporting, working in narrow markets, and really, in many ways, making small steps. And what the Pharmacists Fight Back Act really looks to do is, and all credit to Congressman Auchincloss here, right? Because he's the one who's willing to take this sort of quantum step. And it turns out that his instincts were right, and it's resonated because these practices taste bad to folks who aren't necessarily drug pricing experts. And so it's resonated in a way. Congressman Auchincloss called for, I think, 50 people on the bill by Thanksgiving and hit that. And I think we're about 56 all in right now. But what this bill looks to do is really say no more. And it looks to sort of take the bad practices that PBMs stand on, which is drug pricing manipulation, rebate manipulation, patient steering, And it looks to stop those practices. It looks to end the practices that PBMs use to drive prices up and restrict patient choice.
Jake, what got you so interested in PBM reform as a state representative? Your main focus is to be on the constituents, the citizens of the great state of Massachusetts in your district. However, your voice is resonating on a national level now, and now you're involved with the Pharmacists Fight Back Act. But where did it start? Obviously, starting in Massachusetts. Give our listeners a little backtrack as to how this all started specifically to your state.
What's happening in Massachusetts is a microcosm of what's happening everywhere in the country, which is one, we're seeing independent pharmacists under unrelenting pressure, both back of store and front of store, different forces at work there. But in the back of the store, they're being reimbursed by their competitors. And I don't care how good of a small business owner you are. I don't care how savvy you are. It just becomes untenable when your margin is being decided by your competitor. And P.S., your competitor is a Fortune 20 company and you're a Main Street business. And so I was seeing that, I am seeing that up close and personal. I've been able to visit independent pharmacists throughout my district, across the 35 cities and towns I represent. And invariably, the people I talk to are really critical parts of their communities. They are, hubs of their downtowns who draw in foot traffic and vehicular traffic. Then those people then go on and buy a coffee and go to the grocery store and grab a bite to eat. So they create a lot of value for their downtowns. They're, of course, medical providers and trusted medical providers and the most accessible medical providers for most Americans, particularly in rural America. And then third, they're small business owners. They're trying to balance the credits and the debits in a way that's, feels very visceral for their neighbors. And so I've been able to partner with and communicate with the pharmacists in my district to explain why what can feel like very wonky drug pricing policy in Washington, D.C. directly matters to my constituents. It matters about your copay at the pharmacy counter. It matters about the premium you're paying, particularly if you're an employer-sponsored healthcare insurance. And it matters about your community. It matters. Every one of us, I think, can picture you walk through a downtown and you see a boarded up storefront. A lot of times those are pharmacies. It certainly is in my downtown where I live. That's bad for our communities.
Absolutely. If I could just kind of capitalize on that, right? Congressman Auchincloss represents really one of the most sophisticated, medical hubs, medical communities in the world, right? When you think of just sort of the cross section of his district and the work that gets done there. And so, and obviously with a background with family members who are, medical scientists, doctors. And so, to have him recognize the role that pharmacies play in the healthcare system across the country and on main streets and their accessibility, and particularly the role that they play, in rural America, just what a powerful voice to make that point.
Well, they're going to need more support too, Greg. I appreciate that. And I guess the way I view it in my head is they need both front of store and back of store support right now. And so the back of store support, a big part of that is the legislation so that the PBMs have to be neutral arbiters and just, basically using NADAC plus, and where we are reimbursing pharmacists based on the quality of the service they are providing, as opposed to them getting put underwater by their competitors. But they also need front of store support. Some of that's going to be state level policy, but allowing them to expand their scope of practice. I've talked to pharmacists in my district who are providing optical services, who are doing vaccines and diagnostics. And as medical devices become more sophisticated, as we're able to do more outpatient care at a high quality, I think that's an enormous opportunity for pharmacists to expand their portfolio that they offer and to expand their revenue streams, make their businesses more diversified and resilient, and also make them even more useful and engaged with their neighbors and their patients. This is a net plus for American healthcare because we have a massive deficit of primary care physicians right now and nurse practitioners. We need more frontline medical providers who can do the full suite of preventative and primary care.
PBMs were never, ever supposed to become what they are today. They were supposed to be simplistic, administrative abilities to manage formularies, help big employers with organization of med access, and it was never supposed to have the control that the three big PBMs do today. And it's run amok. It's out of control. You know it. We know it. Greg knows it. The listeners, the primary listeners know it. If you don't understand PBMs, there's so much information out there. We have a podcast you're listening to right now. We've been publishing this since 2019. It's changed since 2019. But PBMs are not supposed to be what they are standing in right now. The way that they are doing business today is anti-healthcare, and it's anti-public health. And that's why Jake is so concerned as state representative, and that's why this bill is so vitally important.
This is the point I oftentimes make. In fact, I said this at a recent bipartisan press conference we had is, when PBMs were first incepted, they performed a necessary function. Somebody's got to say no to the big pharmaceutical manufacturers, say, you got to do a generic, not a brand name drug. Somebody's got to manage the formulary. Somebody's got to do the reimbursements. There is this like back end sort of paper shuffling function that needs to get done. But the problem is that they got greedy, right? They realized that there was a lot of money crossing their transom. They realized how opaque the supply chain was. They realized how concentrated they were. They realized how much at the gate they were standing, and they got greedy. And now they need to be reined in, and they need to be returned back to a technocratic service function with a flat rate fee.
Jake, it's refreshing as someone in Congress that understands that. Greg, super excited, current events. We know that there's another bill that's being proposed. Jake Auchincloss is part of this, so we're going to definitely ask for his feedback. But it would prevent insurance companies from owning pharmacies. Now, that's a duh moment for me. Like, oh, duh. Like, why would you ever want your insurance company to own a pharmacy in order to divert business from independents or other chain pharmacies or other patient choice, choosing whatever pharmacy that they want, to push it back to the inefficiencies of these giant mail order pharmacies that just stamp out prescriptions, then nothing more than a money machine, has nothing to do with healthcare. Bring us up to date on that, Greg.
Yes, and Congressman Auchincloss, please feel free to jump in because I know you're a major part of this, right? But so news came out this week about the Patients Before Monopolies Act, which would essentially say, hey, if you're a corporation, you can't own and insure in PBM and own a pharmacy, with a broad definition of pharmacy. So whether it's a pharmacy with a retail footprint, a mail order footprint, a specialty footprint, you can't play in both pools, right? And it would ultimately require divestiture. So really big deal. And Todd, glad you mentioned Stark Law, right? Because healthcare attorney here, right? And compliance healthcare attorney for a long time. And if you're a healthcare provider in this nation, there are laws that protect against self-interested transactions, right? There are laws that prohibit, sometimes maybe even to too many extremes, but there are laws that prohibit physicians from having any kind of a self-interested referral whatsoever, right? So a physician in a clinic referring to a diagnostic lab or whatever the case may be. And there are these anti-kickback laws which prohibit offering remuneration to get reimbursed under a federal healthcare program. And what we have today is the largest companies on earth, these PBMs and insurers, own pharmacies, and they are steering patients into their channels on the grandest scale that we have ever seen in healthcare. So a Main Street physician, can quickly run afoul of criminal laws and incur criminal liability for self-referring to something down the street if that physician isn't complying with certain safe harbors. But yet you've got the largest insurers and PBMs on earth that are just on a massive scale steering into their channels, and they're targeting some of the sickest patients in the country to do it. And Congressman Auchincloss has done amazing work highlighting, some of these markups and what this vertical integration and what this self-interested steering has really led to from a patient drug pricing perspective.
All right. So, Jake, what about the Patients Before Monopolies Act? Can you elaborate on that and bring us up to date?
This is bipartisan. It's bicameral. We just introduced it this week. I'm the lead of it in the House. Senator Warren and Senator Hawley are the lead in the Senate. And I'm working on it with Diana Harshbarger, who's been my partner on the Pharmacists Fight Back Act as well. So we're getting the band back together for this bill. And to me, this is a step towards what is a broader mission, which is within the pharmaceutical supply chain, we've got to separate the medicine from the money. There needs to be a firewall where if you are researching a drug, manufacturing a drug, prescribing a drug, shipping a drug, dispensing a drug, you're on one side. And then if you are managing the claims, the formulary, if you're a broker, if you are doing reimbursement or analysis, anything on the sort of the money side, you're on the other side of the firewall. And those two functions should not be under the same corporate roof, because otherwise you get CVS Caremark, a United Health Group, where you just get massive, at scale, Stark law violations, as Greg, I think, very eloquently put it. The temptation to self-deal is overwhelming, and I would actually argue is irresistible when you consider that they would have a fiduciary standard to maximize their vertical integration to their shareholders. So we have to just force the divestment and force the deconfliction of interest. And there's precedent for this in a very different realm, which is in financial services. So in the 1930s, we passed the Glass-Steagall law, and the Glass-Steagall said to banks, hey, listen, you can invest money, right? You can go out there and speculate, or you can hold customer money, but you cannot take customer money and then go out and speculate with it. And that was a good idea. It turned out that was a good idea because there needed to be basically this demarcation of interest where you're doing one thing or you're doing the other thing, but never the twain shall meet. We got to do a Glass-Steagall for the pharmaceutical supply chain, and this bill is the first.
Jake, it's so important for our community, for pharmacy owners, for patients. Maybe we can educate patients to keep things going. The momentum of the Patients Before Monopolies Act is going to come right after the Pharmacists Fights Back Act, which is amazing. But from your advice to the listener, what should they be doing? Is there anything else that can be done to keep the momentum going on these new bills?
Engagement matters. I will tell you this legislation, I set the goal of 50 co-sponsors by Thanksgiving when we introduced it late in the summer. And that was a stretch goal, to be candid with you. I mean, we were out of session for a number of weeks because of the election, right? Obviously, right during campaign season, it's a tough time to build out bipartisan support for a piece of complicated legislation. So it was a stretch goal. And as Greg said, we beat it. We beat 50 by Thanksgiving. And that was not because I'm so charming on the House floor. That was because pharmacists throughout this country and Pharmacists United for Truth and Transparency and APCI and NACP and others reached out to their legislators and did the work of saying, this is important to me. And I know people are cynical about members of Congress and how tuned in they are, but I will tell you something. When a constituent business owner, when a constituent resident comes to your office and says that something matters to you, members of Congress listen. I mean, we are in the constituent services business, and we listen when people say that. And so that outreach to your local member of Congress absolutely is the reason we got past 50. Now, what do we have to do going forward? Well, one, we're going to reintroduce it. We're going to build out wider support. But now comes the even harder part, is because we are now going to be up against a ferocious counter-lobbying effort here from PCMA, from the PBM's major lobbying outfit, and maybe even more impactfully from the health insurance companies themselves.
Yeah.
And they're going to make one core argument. At the end of the day, I mean, they'll do a lot of hand waving and a lot of BS, but at the end of the day, when they're meeting with leadership and they're really trying to kill this thing, they're going to say one thing. And the one thing they're going to say is, this will raise premiums. No politician wants to be associated with higher health insurance premiums. And so as an entire coalition of people who want to see a rational pharmaceutical supply chain, we need to do, I think, more work on laying out the evidence for why that is a scare tactic, for why it will not raise premiums. And what I have consistently said to Democrats in particular is, this is a fight that we need to pick. If we don't think as a political party that we can go in front of the American public and say, United Health Group made $7 billion in profit last quarter, but they're claiming that if we try to lower your copays, that they have to raise premiums on you. Who do you trust, them or us as a party? If we really don't think that we can win that fight, then we should just hang up our cleats, because we're not going to win elections then. Like, this is something that we absolutely can campaign and win on, but we have to have the gumption to do it.
Hey, Greg, you mentioned end of year packages. We know something is already being proposed. It's out. We have even a stall in getting the budget passed, but this is all part of it. I know you have other things that you wanted to share. I want to turn it over to you.
Yeah, and of course, Congressman Auchincloss, please feel free to jump in here, right? But there has been talk of, a potential end of year package where PBM reform could be included. There's been a lot of talk of maybe some lower cost, more transparency, which passed out of the House, which contemplates, some Medicaid managed care reform, which we like a lot, as well as some drug pricing transparency, as well as some packages out of Senate Finance as well, MIPA and Better, which contemplates some delinking concepts, as well as some other things. But, one of the things that I'd like to point out about Pharmacists Fight Back Act here is, this is a bill that was introduced in July of this year. And it has gotten massive grassroots attention, right? And I think a lot of that is that pharmacists, providers, patients have seen someone who's willing to come out and be a loud voice in support for change in Congressman Auchincloss. But this is the bill that the PBMs are the most afraid of, right? This is the bill that the PBMs are going into offices talking about. This is the bill that they don't want to see included in the package. And I would argue that's a mandate on why it absolutely should be included in a package, whether it's end of year or whether it's early next year. But make no mistake, there are pharmacists who've spent weekends writing thousands of letters, right? Between, cumulatively, pharmacists throughout the country. They're holding up signs for 9096 in their pharmacy. They've got on their social media sites, I support 9096. At the NCPA convention, there were 9096 or die pins. So there has been a true grassroots movement here on this bill. And this is the bill that is going to fix a lot of the problems. And this is why it absolutely should be, under the noses of leadership and should be considered and a material part of any true PBM reform package. And I'd like just one more point I'd like to make here is they're absolutely going to, the PBMs and insurers are going to say, as the sun rises, right, that premiums are going to go up and drug prices are going to go up. And for so long, pharmacists have been ringing the bell, but a lot of what they've been pointing to has been anecdotal. But we're in a different time now where we have access to data. And we have really smart people looking at that data. And good data drives good policy. And whenever we look at the data, what we see is, hey, surprise, surprise, mail order wasn't saving money. PBM specialty pharmacies weren't saving money. They were marking up 100%, 500%, 47,000%. On the mail order for everyday generics, 79% of the time, the mail order was higher in a federal plan. 3-Axis is doing great work. And so we have to lean into the data to direct and shape policy and to counter sort of these red herring arguments that anything you do to rein in bad PBM practices is going to somehow raise premiums and or raise costs at the counter.
Representative Auchincloss, I just want to say thank you so much for taking the time to talk with us on the PBM Reform Podcast. I want to give a shout out to our pharmacy owners. This is important information. Please use these podcasts, use this interview to talk with your own state representatives. Send them a link to this podcast and have them listen to this. This simplifies a very complex part of healthcare. It's probably one of the most confusing. It's becoming clearer. The data is finally rising. We know that PBMs are not doing what's in the best interest of healthcare and of public health. Jake, you know that. Greg, you know that. We all know that. Listeners, you know that. But your politicians, your government agencies, they may not understand it. And we're assuming that they don't. And you, the listener, should assume that your state representative and your state senators do not understand it. So get them this podcast episode, educate them, have them ask lots of questions of the panel that's being formed, the other legislators. I just want to say once again, Jake, thank you so much for being here with us on the Pharmacy Podcast Network.
Thank you so much for having me on. I enjoyed the conversation and happy holidays.
According to a recent news release, the aptly named Patients Before Monopolies Act was designed to limit the conflict of interest that are negatively impacting patients in independent pharmacies alike. Look this up. Once again, it is the Patients Before Monopolies Act. This has been a pleasure talking with you, Greg. Thank you so much for all of your work. We heard a rumor that you're going to be doing other things with Pharmacy Podcast Network throughout 2025. We cannot wait for you to dig into more of the PBM Reform Podcast content. And Jake, thank you so much for your services. Thank you for what you're doing for your state, but also our nation. Greg, I'm excited about 2025.
Thank you so much. I'm looking forward to it.
For listening to the PBM Reform Podcast, please subscribe on all of the podcast platforms, whichever one's your favorite, Apple, Spotify, Spreaker. We wish you a wonderful holiday season. We look forward to a much more profitable 2025 in the pharmacy sector. Please reach out to the Pharmacy Podcast Network if there's anything we can ever do for your state organizations, for companies that you work for, you as an individual entrepreneurial pharmacist. This is your network of podcasts, and we all are working together to make pharmacy better. And with that, I thank you for listening to the Pharmacy Podcast Network.